Check 1 2. Hey everyone, this is Derrick Broze with the Conscious Resistance Network, and today is June 10th, 2020. Today we're going to be talking about some hypocrisy in the COVID-19 recovery, as if there hasn't been enough already. But this is specific to the Black Lives Matter protest, the protest in support of George Floyd, which I have been at and have been documenting here in Houston, and generally do support calls for reducing police violence and reducing police budgets and all those sort of things, and how that intersects with the COVID-19 recovery response. And again, just hypocrisy in these different crowds that I see. And it's important for us, I think, to dissect this and to look at what's really going on, to examine these flaws. Because if we don't question what's going on, if we don't think critically about what's happening, if we just blindly accept what's being put in front of us, well, then I think we probably deserve whatever's coming. And I don't know, I guess we're just not intelligent people. It's important to be critical, to question, to think, and to look and what's going on in front of you, and also what's not in front of you, what's not being told to you. So before we get into all that, I want to remind you guys to bookmark my website, theconsciousresistance.com, which is your home for all of my content, where I've been broadcasting and issuing reports since 2012. theconsciousresistance.com. You can find my books, download them for free, watch my documentaries for free. You can follow us on Minds. You can follow us on Hive. Join our Discord channel. I highly recommend signing up for my text list. Also, follow me on Float. Some of you might be watching via Float right now instead of Facebook or YouTube, and I appreciate that. But if you haven't, joined float.app. And then, of course, my videos are on BitChute and Library. And if you want to support, you can find me on patreon.com/Derrick Broze. So, all right, let's move right into it. I don't know if you guys have seen this whole story that I'm talking about. Hey, good morning, everybody. But in the last recent days, there was a statement released by health professionals talking about their support of the protests that are going on right now. You can see this being all over the New York Times and Wall Street Journal. It's everywhere. Over 1,000 health professionals sign a letter of over 1,000 health professionals. Here it is, just being repeated. So let's get right into this. Over 1,000 health professionals sign a letter saying, "Don't shut down protests using coronavirus as an excuse." A group of health and medical colleagues has penned an open letter to express their concern that protests around the United States could be shut down under the guise of coronavirus health concerns. Now, this is interesting to me because the letter, which does have more than 1,200 signatures, and probably even more at this point. Sorry, guys, I'm messing with my mic. There we go. It probably has even more signatures at this point. It focuses on techniques to reduce harm to people protesting racial injustice. So basically, we have many of these nurses and healthcare workers coming from the University of Washington's Division of Allergy and Infectious Diseases. And in their letter, they're saying that they want police to reduce violent methods towards protesters, and they also do encourage social distancing. I want to say that. Let me just read a little bit from the letter. It says, "We created the letter in response to emerging narratives that seem to malign demonstrations as risky for public health because of COVID-19. Instead, we wanted to present a narrative that prioritizes opposition to racism as vital to public health." So they're taking a political position. They're saying racism, which I think any intelligent person opposes racism, is vital to public health, including the epidemic response. So once again, they're kind of linking these topics together. "We believe that the way forward is not to suppress protests in the name of public health, but to respond to protesters' demands in the name of public health, thereby addressing multiple public health crises." So the letter focuses on health guidance for protesters and law enforcement, such as wearing masks, advocating to not hold people who are arrested in close proximity, and opposing the use of tear gas for health reasons. Quote, "Staying at home, social distancing, and public masking are effective at minimizing the spread of COVID-19. To the extent possible, we support the application of these public health best practices during demonstrations that call attention to the pervasive lethal force of white supremacy." So these University of Washington Division of Allergy and Infectious Disease healthcare workers and nurses and others who have signed are jumping into the fray and taking a political position, which is fine. Everybody's got an opinion at the moment, right? And there's nothing illegal or wrong per se about that. But let's continue here. However, as public health advocates, we do not condemn these gatherings as risky for COVID-19 transmission. We support them as vital to the national public health and to the threatened health specifically of Black people in the United States. We can show that support by facilitating safety, safest protesting practices without detracting from the demonstrators' ability to gather and demand change. And then here's the key part. This should not be confused with a permissive stance on all gatherings, particularly protests against stay-at-home orders. So follow with me. They're basically saying, look, black people, we believe black people are being attacked, and white supremacy is, a horrible thing. And so we are calling on the cops not to shut down protests in the name of fighting against COVID-19. Instead, they're saying by allowing the protesters to protest and listen to their demands, you can actually address the public health crises, which is people who die at the hands of police. And that makes sense to some degree. But they clearly politicize this by adding this statement in here that, by the way, don't get it twisted. This does not mean we support all protests. So those of you who were protesting a couple of weeks ago to get your businesses reopened, or people who just have questions about the COVID-19 and the mixed messages we're getting from the World Health Organization, including just a couple of days ago where the World Health Organization said, hey, asymptomatic people cannot spread this thing. It's very rare. Whoops, they're going to backpedal and they change their mind and say it's more complicated than that. The point is that people have questions. People have to get back to work. People are concerned about their livelihood. People are also concerned about lockdowns in general, contact tracing, immunity passports, a lot of these things. And people were protesting. And as you guys have seen, and I've posted on social media in recent weeks, people were arrested, moms and all kinds of people. There was a crazy video from Australia that we covered where a woman had her child torn out of her hands because she was at a protest and she didn't social distance enough. I mean, we've been seeing that sort of thing. And the whole time there was mainstream articles running saying that the people who were protesting the lockdown were going to spread the virus. And, new report says that, the protesters are spreading the virus from one place to the other because most of them are coming from out of town and they're visiting other places and they're traveling across states and all this kind of thing. And so it was kind of setting the stage for the second wave to be blamed on the anti-lockdown protesters. But then now this particular group of people, which once again is coming from Washington, University of Washington Division of Allergy and Infectious Diseases, are basically taking a political position and saying that we support the Black Lives Matter protesters and those who stand against white supremacy. And hey, don't shut them down because, staying at home is valuable. Social distancing is valuable. Public masking are effective. So don't shut them down. And look, I have been to some of these protests. A lot of people are wearing masks. And I think, there's plenty of evidence from the other experts, that are saying that it is not safe. Plenty of experts that are saying that it's not safe and that they're wearing masks actually could make things worse, unfortunately. And, so whatever. Excuse me, guys. All right, sorry about that. Miriam's calling me. So I just wanted to bring this up and point out to you guys that, look, if this virus is as deadly as we're being told, then shouldn't it apply across the board? Shouldn't people who are going to get sick for protesting, for being on the streets, shouldn't that, apply all across the board? And yeah, I saw this yesterday. You guys saw this headline. They're now calling non-mask wearers psychopaths based on a study. So if you go out and protest for one reason, it's okay. But if you protest for a different reason, it's not. I mean, it's very disturbing to me. It's, I don't know this, and I'm not trying to attack the Black Lives Matter movement or protesters or anything at all, because I believe we need to be out there protesting, pushing back against police violence. I believe in defunding, demilitarizing, disarming, and disbanding police departments and going towards community policing. I believe a lot of the same things. I also am skeptical of how big this movement is getting, and the fact that, again, why is one movement told if you're out protesting, the virus, which everybody's being told to be afraid of, well, that's not a good thing and you're going to spread it around and this and that. But if you're protesting against racism or protesting against certain issues that the mainstream all of a sudden supports for one reason or another, then it's okay. I mean, it doesn't make any sense, guys. Am I missing something? Somebody inform me. Is it because I'm a man and I'm incapable of understanding the issue? Is it because, I don't know. I'm kind of being facetious here, but I'm trying to understand, what am I missing? COVID-19 concerns shouldn't shut down police brutality protests, health experts say.
Over 1,000 health professionals signed a letter saying, don't shut down protests using coronavirus as an excuse. So it's all over the mainstream right now. This letter was circulated just last Friday. It's got more than 1,200 signatures, probably even more by now since it's making the mainstream waves. But I don't know, guys. What do you think about this? Is it just yet another sign of the hypocrisy of the COVID-19 recovery and the COVID-19 response? Is it something deeper? Is it just one? No, it's not like this is the government themselves. This is just one university, school, and it's only 1,200 health professionals. It's not like it's millions, but still, this is a mentality that we're seeing. Why is the media all of a sudden? I mean, even just look at this picture. There's hundreds of people in this picture, and a lot of them are wearing masks, but maybe not all of them. And again, I think it's debatable whether masks are even worth it. I don't wear masks, so even when I go to these events, I'm not wearing them. I don't go around wearing masks no matter where I go. But even if you argue, well, they're wearing masks, they're clearly not practicing social distancing, which all of us have been told, and they've attempted to condition us the last couple months that if you're not social distancing, then you're part of the problem. And, you know, just these silly divisive tactics that I think that many of us have seen through. And yet now it's like all of that disappeared. All that disappeared. All that talk of racism and of people, trying to stop the spread of COVID-19 is gone in favor of just focusing on the issue at hand. And honestly, the more time that goes on, to me, this seems more like just the latest episode in our soap opera that continues to play out in front of our eyes, what we call America. Last week it was, for the last couple months, the storyline has been focused on COVID-19, and now we're at a place where it's focused on police violence. And, don't talk about the war, don't talk about the militarization of the police, don't talk about how both parties screw you over, and both parties do not care about Black people and, people of color in general. Don't talk about the history of violence against all people. There's just so many issues that are being missed, and I'm not trying to police from the sidelines. I'm glad people are expressing their voices. I hope people really start thinking deeper about this, though, and thinking about how we might be being played again in one way or another. So I'm going to leave it there for now, guys, though. I appreciate everyone who's tuned in. Again, please do bookmark theconsciousresistance.com. Sign up for my text list if you haven't already. And please continue to question the narratives that are being sold to us. I just happened to come across this story, and I do think that it's worth us continuing to explore and to question. So please share this video with your friends. Ask them. Just start a conversation. Do not be afraid to engage with your friends who believe differently than you. Ask them, how come one set of protesters are told that they're going to spread the virus and that it's going to, make everybody sick and we should blame them, we should arrest them, etc., and then another set of protesters is not? At the very least, this is hypocrisy, and it's politicizing of an event, right? Let's imagine that the pandemic was as disastrous as we've been told, and that people were just falling dead in the streets, and yet they allow these protesters to continue. You know what I'm saying? Like, I hope this makes sense, guys. Anyways, till next time, thank you for listening. This is Derrick Broze with the Conscious Resistance Network. I'll see you later today for the fluoride trial. Remember, you are powerful, you are beautiful, and you are free. Peace.